Hello. So today I'm here with Cerebral Torque. We recently filmed together in my clinic recently to talk about neck pain and migraine. And after we were done filming, he mentioned that he was in the middle of a migraine attack. So we decided to try one of the manual therapy techniques I frequently use in clinic called a reproduction and resolution technique or a sustained manual pressure technique. Now, this isn't a curative technique, but it can have effects to modulate the central nervous system and decrease referred pain that can be triggered from the neck. So I wanted to bring in Cerebral Torque and talk about what his experience was, so people that are interested can kind of learn a little bit more about it. So what was your experience initially when I kind of talked to you about the technique, and then what happened after we did it in that clinic that day?
So it was actually quite interesting first learning about the technique because I've never heard of it before. And just you applying it, I didn't have any expectations. In fact, I had low expectations. I wasn't expecting anything to really happen because there are many things I guess I've tried over because I've had pediatric migraine, so I've had it for decades now. And it just evolved. Now it's much better. However, as I was mentioning to you, there is a neck pain component of my migraine attacks, and differentiating between whether it's a symptom in prodrome or whether it sensitizes the brainstem and that contributes to the development of my migraine attacks. Not really sure. It's always hard to say and differentiate. Best to just treat both simultaneously. So I thought, why not? Let's give it a shot.
Mm. Yeah. So then we kind of talked about it, had you lay down on the table, and all I did was apply a slight pressure right around your suboccipital area. And when I did that, did it reproduce anything, like any familiar symptoms that you typically have with your migraine?
So the way my
You were
mic
in a
so
migraine, so I didn't reproduce it. It was already kind of there.
right. So I had my migraine attack at the time was in basically the left hemisphere, and it kind of went to the posterior of my eye. So it was radiating from my neck to the just my anterior face, so like the V1 area on the left side, and so that's where it was. And then you did your procedure on the left side of my neck
You said
posteriorly.
the V1 area. I know people watching this aren't going to know what that is. So let's talk about that a little more. So the V1 area is that one branch of the trigeminal nerve that kind of comes and gives or gets sensory input from kind of like that forehead eye area.
Correct. So there's V1, V2, and V3, all branches of the trigeminal nerve, and V1 is one of them. And it basically offers, well, it's carries sensory information from this area.
Hmm.
So that's where the majority of my pain was. Um, and it was, I, I would characterize it as a stabbing and pulsating pain simultaneously.
Yeah. So then the technique kind of has five holds that are held about 90-ish seconds. After the holds, what were you experiencing after? Where was your migraine attack like? Where was your neck pain at that point once we were done the treatment?
So I'll actually start by saying like during the treatment as well because there were changes there. So during the treatment, so I had the pain, and then you did what you did on the left side of my neck. So immediately after pressing, after a bit of time, a few seconds, there was definitely a decrease in pain. And then when you
No,
release,
there was a sudden increase, then
so immediately
plateaus.
immediately after palpating the left side, there's an increase, and then there was a decrease seconds later.
Hmm.
Is that what's expected? Because that's what
Yeah,
happened.
that is what's expected. Yes, that's
Okay.
what's going to happen. It should peak, kind of get kind of intense for a second. It
Right.
and then it varies for people. It's anywhere from 15 up to 60 seconds for that to plateau and then start to level out and then decrease.
Right, because there is incredible pressure that you applied. It's not just like a light
It is light
palpation or
pressure
light
though.
touch.
It's pressure that's about 1 to 2 kilograms of pressure, so it's not much. It's about enough force. So if you push your finger down to blanch your fingernail, that's about as hard as you need to push to elicit that type of response. It's
So
not
what's
much.
happening is that my neck is incredibly sensitized because
Yes.
it did feel like a lot of pressure.
Hmm.
Um,
Yeah, and that's
it,
what almost everyone says when it kind of has a beneficial effects like it did for you is that it's very painful, but and it feels like I'm pushing like super hard, but
Right.
I'm not applying that much force because I don't need to.
Well, that's quite interesting. Yeah, so it felt like a ton of pressure. But yeah, you're right. And the way that you positioned it, it's really hard to apply that much pressure in that kind of position. So that's
Hmm.
actually true. I was supine, not prone, right?
Yeah. And like
So
if people want to see what that video or treatment looks like, I'll kind of tag it here in the bottom so you guys can like click to link and see what that video actually looked like and what the treatment looks like. It's pretty gentle actually.
right, yeah. So well, that's interesting. So immediately after, it is a lot of pain, but it dissipates in a few seconds.
Hmm.
And then you release, and then the pain does come back afterwards, after the release. So
Yes.
that's what I
Because
experienced.
you were in the middle of an attack. So that,
Right,
yeah,
correct.
it's not going to completely resolve it, right? When you're in the middle of attack. If it was more interictal, you were between attacks, what I would expect to happen is they would kind of do the same presentation. You would have an onset of headache, it would get real intense, plateau, and then start to decrease, and then come very low or completely resolve while I'm holding, and then once I let go, it shouldn't be there anymore.
Right.
Right? So then once we left the clinic, headed back home, what kind of the rest of your day look like after that compared to like your normal attack symptoms or attack progression for you?
Yeah, so I was actually texting you on the way home,
Yep.
telling you that it
Your
is
voice
so
to
much
text me
better.
while you're driving home.
But yeah, so there was incredible relief, right? So I was incredibly surprised by that because by that time I didn't have any of my medications with me when I went to Philly. So I was like, usually by this time of a migraine attack, I need my acute or abortive medications, and so I didn't have those. But then I still found myself finding a similar type of relief, and I was so surprised by that. Usually, time doesn't really work for me. I would need medications and I would need sleep, and then
Hmm.
by the next day, if I'm lucky, the migraine attack is gone. So that's usually the course of my migraine attack. So I usually don't get relief immediately. Of course, the idea of placebo is still always in the back of my mind,
Hmm.
but I'll get to why it wasn't the case in this scenario.
Yeah.
So there was relief. However, towards the end of the night, the migraine attack, because I opted not to take any abortives. Probably not the smartest decision, but I just wanted to see uh, what would happen, basically, because I found this all very interesting. So by the end of the night, while I had finished editing the videos that we had done during that day, during the morning, which, by the way, doing that during a migraine attack is completely impossible.
Yeah,
So
that
there
was
was
very
definitely
daring of you.
relief, right? Yeah. So there was definitely relief there. And then towards the end of the night, it did creep back up. So the migraine attack pain, the headache phase was much more prominent.
Gotcha. And that makes sense for like what was going on, not taking the abortive, and kind of like what you did afterwards, and then a drive afterwards as well,
Right.
right? That's pretty good. So since that session, it's been almost 2 weeks since you were kind of in clinic, got the one treatment session. What have you noticed, if anything, in terms of like your neck, tolerance with like holding your head up, sustaining postures, or like how your migraine has been showing up for you?
Okay. So the very next day, the migraine attack was gone, which can happen normally with me. So I didn't take that as any sort of sign that this procedure was effective. There is pain. Well, for me, there was on my neck, and that lasted for about 2 days. Actually, it was tender, but
Hmm.
nothing. It actually, in a strange way, it felt good. It was kind of a good type of pain. So odd thing to say because how is pain good? But in this case, it kind of gave me a bit of relief that I
Yes.
had like just this section of pain, but no head pain, right? And so I forgot about it. I didn't. I have other things going on, and so I didn't
Hmm.
think much of it. And usually, I was telling you, what really brings on my migraine attacks is the way I lay down because sometimes I just do readings on my bed and I don't have good posture when I do that, and so I would lay down on the right side with just like maybe like my hand here or whatever. It just not great posture, and then almost every single day I would get a migraine attack the next day. It always happens. And I still do it because I just love reading in that position, you know, and I just take an abortive and move on with my life. So I still did that, and this is why I will say I doubt it's placebo because I slept that way the next day. Thinking back now, I didn't get a migraine attack the next day, which is unheard of for me. Of course, other people have their own triggers, you could say. I don't like particularly like using that term, but other people, it's what people understand. So everyone has their own triggers. For me, that's my major one. The way I read, the way my posture when I read, and so I continue to do that, and I noticed I didn't develop any migraine attacks. Now, also I don't get the best sleep, and when I don't get the best sleep, that's also another one of my major triggers. That happened. I did get a migraine attack due to poor sleep. The medications were much more effective, I realized. So I found that to be interesting. Again, it's only been 2 weeks, correct? So,
Yeah, and normally like, the protocol really has like 6 total applications of that technique over like a 3 to 4 week time frame, and we only did one. So to me, like that's a lot bigger improvement than I was even expecting for you. But with that, like, how did the overall experience with this kind of like, did it change how you think about like the role of the neck in migraine management?
So I've always had an idea that the neck is involved just because of the convergence of the pathways in the trigeminal cervical complex. So the neck is definitely involved. Whether or not how much it contributes, it's definitely dependent on the individual. Everyone's different. For me, I didn't know how much it was involved, and so this was the huge revealing factor for me that the neck pain was a significant contributor to I want to say my sensitization of my nervous system overall.
Yeah.
And so,
And that's very similar to how I look at it. It's not like the neck is the cause of migraine.
right,
That's not the right way to frame that. And if you go back to like listen to our previous talk about neck pain and migraine, that my belief is always shown that like it's not the cause of it, but it can be a meaningful. I think it can be a meaningful like contributor to the overall system. And when we look to like calm things down locally, it can sometimes help really reduce that like threat signal that can be feeding into attacks.
right, absolutely. And so, yeah, so that was a huge component for me. And again, I know for a fact this wasn't placebo because I completely forgot about this procedure after a week and a half. And then I realized I've been sleeping or not sleeping, reading in a poor posture for the last week and a half, and I haven't been getting migraine attacks as a result of it. Now, I will say, 2 days ago, it did happen. So there's definitely something you need to continue this procedure. It's not something you do once and you forget about it because yes, while it was effective, I did realize 2 days ago and it wasn't as bad, and it did go away with just acetaminophen, or if you guys paracetamol from the UK, just Tylenol in general. It did go away with just 1,000 milligrams. So not usually what happens. So medication was definitely more effective. However, it's definitely, I noticed that it's something that probably needs to be repeated over an extended period of time.
That can be helpful, and the other way to help support that and maintain some of the benefit is neck and shoulder based exercise to really help continue maintaining the effects of that manual therapy.
Right. And what I realized also is that if I lay down on the other side, it doesn't result in a migraine attack the next day. So it's definitely location specific in terms of the neck.
Mm-hmm. Yeah, that's great.
Interesting.
Any other comments about the technique, your experience with it since then?
I will say, if neck pain is a factor of your migraine attack, whether it's you think it's part of prodrome, or that maybe it just sensitizes your nervous system overall, contributing to an increased frequency, duration, or severity of migraine attacks, I think this type of therapy and procedure is definitely something to look into. I'm glad I found it, but I wish I actually found it earlier. that would have done me a lot of good. So it's definitely something that everyone should look into. And if it doesn't work, it doesn't work. If it works,
Yeah.
great.
Yeah, usually in that first session, if it's not really bringing it down, that first application, because it's like the test for it is itself the treatment. So if like the first assessment doesn't really work and it doesn't come down, it doesn't almost completely resolve, it's probably not going to work. And that's regardless if you're within the migraine attack itself or you're interictal.
Right.
So great. Well, thanks for coming on
Wonderful.
and talking with me about this
Thank you.
and
Thank
sharing
you
your
for showing me
experience.
this. Thank you for showing me this procedure. I definitely
Yeah.
appreciate it.
Great. And just to reiterate, again, the manual therapy technique and addressing the neck isn't a cure for migraine. It's just a way to help modulate the system a little bit to improve outcomes. But again, you still have migraine. It doesn't change that fact that you have a neurological disorder. It's just one way to help manage it.
Correct. All right. Thank you.
Have a good one.
You too.